September is Prostate Cancer Awareness Month. About 1 in 8 men will be diagnosed with prostate cancer at some point in their life. It is the second leading cause of cancer death in Americans. However, early detection through screenings can detect prostate cancer before symptoms develop, also make treatment much easier. Here to speak with us today about this subject is Dr. Krishna Bhatta, urologist for Northern Light Health. Welcome, Dr. Bhatta. We appreciate you being here. Let's start first with talking about what prostate cancer actually is and just how common it is.
As you said, Terry, and thank you for inviting me. This prostate cancer is the leading cancer in men, and it's a small gland just below the bladder surrounding the urethra, and its location is a little difficult to reach, and that's why many men kind of shy away from early detection. And I think it's important. If I have to make one point today, that will be go and get your prostate checked and go and get your PSA checked once you are in that age range for PSA screening.
Doctor, what are some of the symptoms of prostate cancer that we should be on the lookout for?
So there are symptoms, which are very similar to prostate enlargement. So it's not so much the symptoms, although you can have slowing of your urinary stream or getting a few times at night or not able to pee sometimes. But that could be symptoms from enlargement as well. So that makes it harder because many people will say, I have no symptoms. But still, I think the important question is, should you have the blood test and should you have a prostate exam?
Doctor, we know that men should be screened. When should they do that, and how would that process work once you decide to go ahead and schedule an appointment?
So from the AUA, which is American Urologic Association, the guidelines are starting at 50, you should have your PSA screening. And if you have family history or you're African American, as early as 40 is where we should start having those tests.
And if somebody is diagnosed with prostate cancer, doctor, what might a treatment plan look like?
The treatment plan nowadays is amazingly good in the sense the robotic surgery has made it much less invasive. I remember days when I started, we used to have people donate 2 units of blood before surgery. But with the robotic surgery, everything has changed. So surgery is one of the options. The other good option is also radiation. And radiation also has changed a lot nowadays. They do shorter segments rather than the full 8 weeks that they used to do.
Doctor, let's talk about prevention. Are there steps that we can take to try to reduce the risk of developing prostate cancer?
Terry, we don't know why it happens. So no, we don't know how to prevent it. There is no real prevention, although there are sometimes, news comes out if you eat tomato or if you have this kind of diet. But there is no real prevention that we know of. So early detection is the key.
All right. Screening is definitely very important. Potentially life-saving information there. Dr. Bhatta, thank you so much for joining us today.
Thank you very much for having me.